Dr. McGrath, what role do genetics play into hair loss as well? Because everyone's always heard of that, phrase that comes from your mother's father, where if you wear a baseball cap all the time.
Yeah.
What role do genetics play in hair loss?
Well, it's obviously a genetic predisposition, and the truth is it can come from either side of the family. It's basic. The basic math is that 50% of men over the age of 50 will have experienced some degree of hair loss. So it's very common. And if you're one of those 50%, it can be very rapid early in life, or it can be very slow and progressive, and that just varies. So it has to do with the genetic predisposition, which can come from either side, in that individual in terms of the genetic predisposition that they have, because it can manifest itself different from person to person. In summary, genetic predisposition is a major cause for hair loss in both men and women. But in women, obviously it can be more complicated than that. There can be multiple reasons why women lose their hair. And anything from iron deficiency up to thyroid disorder. So doing a workup on a female patient, it's very important that you know what you're doing. And you can be able to really pinpoint before you say, yes, this is a genetically inherited problem that you have. So there's a little bit more legwork involved in dealing with female patients.